Hi everyone, my presentation is on violence against women. It is important to know the structural aspects underlying the effects of violence against women. So what is violence against women? Violence can be understood through gender perspective on violence and how gender norms can influence the use of violence. Violence is seen as an aggressive act that only men can portray, and this aggression sometimes means masculinity. If women exert violence or any form of aggression, they are viewed as nasty, vicious, or not ladylike. However, violence may not always be negative. It can be a form of communication for women under social contexts. They use it to defend themselves or they use it to tell their stories. When women display violence, it can mean that they're being abused, they're in a crisis situation, or they need attention. Therefore, living in a patriarchal society can make violence acceptable to men and a problem to women. Violence against women is a major health crisis. Women constitute 50% of the world's population. Not only can violence affect all kinds of women worldwide, regardless of culture, race, class, or geographic location, it is a threat to all societies. Other long-term effects include death, injury, unplanned or unwanted pregnancy, sexual transmitted diseases, abortion rates, physical disabilities, mental health issues, and risk of suicide. Some of the common mental health disorders seen from the exposure of domestic violence are PTSD, anxiety, and depression. Due to the fear responses from the exposure of domestic violence, they may isolate, withdraw from others, and fall into suicidal thoughts. These suicidal thoughts or suicide attempt can be a form of a coping strategy to avoid the situation or escape from the situation. Employment instability is another huge factor to domestic violence because women are financially dependent and sometimes they may even be forced to stay dependent. One of the abusive tactics that batterers use is refraining women from having a job, limiting their access to money, or restricting them from having more income than they already have. This is a common way for abusers to gain control and power of the victim. Human trafficking is another issue that's often invisible, and it plays a huge risk factor to domestic violence. Human trafficking is a form of violence using fear against the victim by exploiting them. Not only can human trafficking put victims at risk for future domestic violence, domestic violence can also cause future human trafficking. So why are domestic violence rates so prevalent? Here are some of the vulnerabilities to consider. Being a young age, such as under the age of 18, alcohol consumption, and having an existing mental health issue. Previously been abused as a child, having a low income or low education level, and also marital status. So there has been studies done that shown that women who have been married longer are at more risk to the exposure of domestic violence. So there's no definitive explanation as to how or why domestic violence occurs, but looking through the feminist perspective and an ecological model, it does provide some explanation. So through the feminist perspective, they argue that we live in a patriarchal structure that enforces male dominance. And because of this male dominance, it influences gender roles, culture, acceptance of violence, and all of this can motivate men to want to have power and control over women. Looking through the lens of the ecological model, they believe that domestic violence exists based on interaction of the individual, their interpersonal relationships, community responses, and societal attitudes and policy. So considering the ecological model, this seems to make the most sense and it seems to be the most popular because it looks at all four of these levels. So policy and prevention. Using a multidisciplinary approach All healthcare providers, policymakers, and lawmakers, educators, and law enforcement officers need to work together. They need to build awareness on the adverse outcomes of domestic violence, develop community programs, and implement effective policies that is against violence and won't tolerate any violence against women. They also need to invest in future research and preventative programs. Some of the preventative programs include case management, advocacy, short-term and long-term counseling, crisis intervention, and other local resources like supportive housing and shelters. So as a social worker, it's important for us to be active and in attending trainings and also continuously educating ourselves. That way we can stay abreast with current issues of women. We need to know the risk factors and effectively screen and evaluate for domestic violence. We also need to learn to communicate appropriately with victims by using compassion, empathy, and also we need to educate them about violence and letting them know that violence towards them is not acceptable. We also want to give clients choices such as counseling, going to a shelter, and also have available resources for them. That way that we can connect them to other resources like coordinated community programs or co-response team. And most importantly, be their advocate, no matter what situation they're in. So this concludes the end of my presentation. Thank you, and I hope you enjoyed.